is worth 1,000 words. Got it? Taking care of us can be so easy.
Take good care of the children.
Hello everyone, welcome to the second panel discussion on the Roving Caregivers Program. The Roving Caregivers Program is an informal early childhood education program that seeks to reach children from birth to 3 years of age who do not have access to any formal early childhood education. Early stimulation for children and parenting education for parents form the core of this RCP program. What has happened to date is that the RCP program has proven its capacity to improve the care of young children, increase their attention capacity, develop basic skills, improve their health and nutrition, and also produce a much better rate of performance both at the preschool and for future education results. The RCP is currently being facilitated by the Caribbean Child Support Initiative, which is a division of the Caribbean Center for Development Administration, CARICAD. The RCP originated in rural Jamaica and has so far been replicated in Dominica, Grenada, St. Lucia, St. Vincent and the Grenadines, and Belize. The Bernard van Leer Foundation of the Netherlands has been the primary financer of the RCP. Currently, however, there is a need to focus on sustainability of this program, and therefore issues related to impact and funding, inclusion of the public, private sector and civil society are also strong considerations. Joining me in the first segment of this program on the RCP and in our second panel discussion, I'm very pleased to welcome Susan Branca-Lashley, who is the Program Director of the Caribbean Child Support Initiative, and also Dr. Didacus Jules, who is the Registrar for the CEO Caribbean Examinations Council. Mrs. Branca-Lashley and Dr. Jules, it's a pleasure to have you both, and welcome again.
Thank you.
Susan, I think perhaps we would all benefit from an idea, for those of us who are not clear, on what is this RCP program in terms of how it's implemented and what are some of the core activities that have driven its success to date.
Okay, thank you, and it's great to be back discussing the
good.
Roving Caregivers Program. I want to start by saying that we live in a region where the needs of those who have a number of economic and social challenges are not treated with any great determination. Children born and raised in poverty very often are placed on an unfavorable trajectory, given that they do not have access to social support services that allow for their early stimulation and development. This often leads to low educational attainment, frustration that comes with that low educational attainment. And of course, very often we see a lot of social fallout as manifested in youth and youth delinquency from a very early age. The Roving Caregivers Program is a multidimensional program that is really attempting to stymie some of these social fallouts that we often witness in our adolescents and young persons. It's intended to provide stimulation for those we consider at risk because of the social and economic uncertainties they're born into, and is really attempting to provide them with an opportunity to be stimulated and certainly to provide for better educational attainment and certainly to allow them to fit better within a productive workforce. The program is implemented in the home, so it reaches parents and children in their natural environment and really offers an opportunity for parents to learn in their own context how they can effectively stimulate their children. As simple as basic conversation, manipulatives, use of their fine and gross motor skills really helping them to develop how they can hold a pencil within a school context, and essentially helping them to be better prepared and ready for school.
Yes.
And this is an important, and certainly research has demonstrated the importance of those critical years, birth to 3 years old, in terms of brain development. Research has shown that that is the period where most of the critical brain development takes place. And it is unfortunate that we have not been adequately treating with this critical age band in terms of the important development that takes place then.
Yes. Dr. Jules, you have seen this program at work in St. Lucia, and further I know you have been preparing a position paper on the Roving Caregivers program. What for you stands out?
Well, first of all, let me say that I think it's important to situate this program in a context. And the context is first of all the deficit in early childhood provision across the entire Caribbean.
Yes.
We have historically treated primary education as the foundation of education. In fact, it is an erroneous view because it is early childhood stimulation and development that is the true foundation for education. In a sense, education is that full continuum, and while we as a region have done very well in terms of the provision of primary education, there's universal primary, we've moved to universal secondary, we are still very far off from universal early childhood provision. The second contextual consideration is that over the last decade, the Caribbean Development Bank has played a really critical role in encouraging the preparation of poverty assessments across the region. And to some extent, these have been used in planning developmental activities. But I think from an educational perspective, we need to make more use of those studies to look at the deficits and to look at it, to be able to zoom in a more clinical and forensic way at the groupings that are at risk and the nature of the risks that they face so that the interventions can be more targeted.
Okay. Yes. Susan, as we wrap up this segment, can you just give me some really key data in terms of your research findings about the impact of the Roving Caregivers program?
The first year's impact has shown that the Roving Caregivers program has made an impact on children's cognitive development, that is their ability to learn. It's also demonstrated a positive impact on their expressive language skills, their ability to articulate and express themselves, and on their fine and gross motor skills, which I mentioned earlier.
Yes.
Interesting enough, the study has also shown what we consider to be multiplier effects, namely the effects that it has on parents themselves in their own ability to parent their children with some degree of confidence,
yes,
and their disciplinary practices. They feel a lot more comfortable with their ability to discipline their children. And another ripple effect is that of the impact on the rovers, as we call them, who are the field workers, young persons who now feel a greater sense of dignity and self-esteem and certainly see themselves as role models within their communities.
Yes. So this early childhood stimulation project has definitely produced far-reaching social and economic results.
Indeed.
And we need to really pay attention.
Yes.
So the RCP is one initiative that is making a profound difference in the development of our children, and we can see that regionally that will rebound to our developmental patterns as a region. We're going to continue our discussion. We'll be right back.